Hello everyone, welcome to the Nurses Habit. My name is Philip. I am a nurse by background, and today I'm still looking at the diabetes series. I am comparing type 1 and type 2 diabetes. Many people have type 2 diabetes, but type 1 is also a very critical type of diabetes that we need to be aware of. Are you ready for me to dive a bit deeper into it, to have the knowledge that you need to help yourself and to help somebody close to you who is having diabetes? Okay, so before we dive in, let me shortly introduce Prestige Care Training Academy. So it is a training hub that we give skill training for carers in the UK, support workers. If you want a training, specialized training in catheter care, stomach care, peg feeding, medication management, then speak to Prestige Care Training Academy. I am the lead trainer. Now let's dive into our main topic for today, the difference between type 1 and type 2 diabetes. So let me first look at type 1 diabetes. Type 1 diabetes is a form of diabetes. Now this diabetes is caused by the body fighting itself. All right, so it is autoimmune condition where your immune system attacks the cells that produce the insulin in your body. So your body fighting against itself so that it will not be able to produce insulin. That is type 1 diabetes. Type 2 diabetes, the body is producing insulin, all right, but the cells are resistant to the insulin. So it's just like you are having key to the wrong lock. All right, you have your key and then you are going to open your door and the lock or the padlock is not working. So there is insulin production by your body, but the cells are not using the insulin. There is a resistance to the use of the insulin. So the body will continue to produce insulin until a time that it will decline or it will stop producing more insulin. That is type 2. But for type 1, there is no insulin production at all because your body immune system is fighting against the a part of the body that's supposed to produce the insulin. So that is the difference. Now let's look at the onset. Because type 1 diabetes, the body is not producing insulin at all. It occurs suddenly. You easily notice it. So if somebody is having type 1 diabetes, the person is going to realize it at a very tender age. So it normally occurs in teens, younger adults, then they will have diabetes. Most of it is type 1 diabetes because it occurs suddenly. Whereas type 2 diabetes, it can occur very slowly and it takes a lot of time for people to notice they have that diabetes. Let's talk about the causes of type 1 diabetes. As I already indicated, type 1 diabetes is autoimmune disease. All right, so it is your immune system malfunctioning that is causing it. But the type 2 diabetes, the cause can be genetic. So people that have parents or great grandparents having it, family history. Signs and symptoms of type 1 diabetes is that people that have this diabetes, they are going to experience sudden weight loss. So people tend to lose weight so suddenly. Why do they lose weight? Because the food that you are eating, we eat food to get energy. There is no energy being generated. The carbohydrates that you eat that's supposed to help you to get this energy is just stored in your blood. All right, so there is no energy, so you are going to lose weight. And then there is increased thirst. You are going to be thirsty every time. You are going to drink a lot of water. The more you drink, the more you all right, you urinate the water. So there is increased urination as well. And then there is blurred vision. These are signs that you can expect or they are very common signs. And these signs are also similar in type 2 diabetes, just that they take a long time to manifest itself. So now let's look at the risk factors. So type 1 diabetes, we are only talking about two things basically: autoimmune and then genetics. Autoimmune is your body fighting against the um, producing system, insulin producing system of your body. So body fighting against itself. And then we have genetics, where people are having it because they have inherited from their parents or is in the family line. Okay. Now, with the type 2 diabetes, the risk factors, so many things can be predisposing risk factors. We are talking of lifestyle. So, if you are not having good lifestyle, smoking, alcoholism, they can cause you to have diabetes. So, lifestyle, your diet, not eating the right kind of food, not eating balanced diet, they can cause that. Obesity, as I said, many people wants to be obese, many people wants to be fat, many people wants to be big, but it has a lot of health complications. So obesity can also predispose somebody to diabetes. Then lack of exercise, sedentary lifestyle, when people are sitting idle and all of that, they can predispose you to getting diabetes. So that's the difference between type 1 and type 2 diabetes. Things that can be worked on in type 2 diabetes: when you change your lifestyle, you change your diet, you change your nutrition, you change your activity level, you can control it, or you can prevent yourself from getting type 2. But type 1 is not really like that because it is autoimmunity. Management of type 1 and type 2 diabetes. Lastly, what is the difference? So because in type 1 diabetes the body is not producing insulin, it means that you are going to have insulin every time of your life. So you are dependent on insulin. That is why type 1 diabetes, we also call it insulin dependent diabetes. So you are going to be on insulin and you are going to have insulin for life. But with type 2 diabetes, it is managed with lifestyle changes, it is managed with diet changes, increasing your activity, and those lifestyle modifications, they are going to help you to control your diabetes. And in some cases, if lifestyle changes are still not helpful, then they are going to prescribe medications for you. And if everything is still not working, they can also put you on insulin. So with type 2 diabetes, you can have medications, you can have insulin, and then lifestyle changes can also play a role. These things, so either lifestyle changes, taking care of what you eat, your exercise, and everything. With medication, you are going to be fine. There are so many people that do not even have to have insulin for type 1 diabetes. You are going to have insulin. So if you know any somebody that is always having insulin, even from childhood, has to be administering insulin every time, then definitely it is type 1 diabetes. That is how it is managed. That is how it is controlled. The good thing is that we teach patients how to self-administer their insulin. So you check your own blood sugar, you administer your own insulin, you take control of your own life. I have met patients, I have met people that have been administering insulin for 50, 60 years. I have met people that have been diabetic for over 70 years, and they are taking charge of their own self. They are administering their insulin, they are managing their own conditions without any problem. So being diabetic doesn't affect you from going about your normal activities. It can be managed and you can do whatever you want to know. The only thing is that you need to take care of yourself. You need to be responsible for your own health, and you need to control your diet. You need to check your blood sugars, and you need to take your medications or your insulin accordingly as prescribed by your doctor. If you have any question about diabetes, you can chat me, you can email me. at philipousu550@gmail.com or the nurses heartbeat@gmail.com. If you want to share anything about diabetes, if you are a patient, you know somebody, anything, just talk to me and we can make this podcast a lively one. Thank you very much. See you in the next episode. If you like it, I want you to follow me. If you are watching on YouTube, I want you to also subscribe for me. I will come to your way with more episodes, exciting ones. Thank you very much. See you. Bye.